The Moderna COVID-19 vaccine is designed to protect you from the coronavirus disease, also known as COVID-19. It has been shown to be effective in protecting most people against COVID-19, and may also help reduce the severity of the illness if you do get infected. It is important to note that vaccines may not fully protect everyone who receives them, but they can still help in fighting the virus if you are exposed to it later. It is recommended to consult with your healthcare professional for more detailed information, such as the FDA Fact Sheet for Recipients and Caregivers, the Health Canada Patient Medication Information, or the Informed Consent Form for a study. When considering taking this vaccine, it's important to understand that it should be administered as a 25 micrograms per 0.25 milliliters IM suspension and has been authorized for emergency use. Be sure to follow the recommended dosage and timing as directed by your healthcare professional for optimal effectiveness. Before receiving the vaccine, make sure to read all the vaccine information provided by your healthcare professional. If you have any questions, don't hesitate to ask. This vaccine is administered by injection into a muscle by a healthcare professional, typically in the upper arm. For young children, it is usually given in the upper thigh. It's important to closely follow the vaccination schedule given by your healthcare professional, and you may find it helpful to mark a calendar as a reminder. Be sure to keep all scheduled medical appointments. Vaccine injections can cause pain, redness, or swelling at the injection site, as well as tiredness, headache, fever, muscle/joint pain, chills, nausea, vomiting, or swollen lymph nodes. If you experience any of these effects, it's important to let your healthcare professional know right away. In rare cases, temporary symptoms such as fainting, dizziness, vision changes, numbness/tingling, or seizure-like movements have occurred after vaccine injections. If you have any of these symptoms soon after receiving an injection, it's important to seek medical help promptly. Sitting or lying down may help relieve these symptoms. It's important to remember that this vaccine has been prescribed because your healthcare professional believes that the benefit to you is greater than the risk of side effects. Many people using this vaccine do not experience serious side effects. There have been rare reports of swelling of the heart muscle, myocarditis, or the lining of the heart, pericarditis, that occurred within a few days after receiving this vaccine, especially after the second dose. If you notice symptoms such as chest pain, shortness of breath, or a pounding heartbeat, it's important to get medical help right away. While very serious allergic reactions to this vaccine are rare, it's important to seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your healthcare professional if you notice any other effects not listed. If you have any concerns or questions about side effects, it's important to discuss them with your doctor. Before getting the Moderna COVID 2023-24, 6mo-11yr, PF, 25 mcg/0.25 ml in suspension, EUA, COVID-19, SARS-CoV-2 vaccine, make sure to let the healthcare professional know if you have any allergies to vaccines or polysorbate. This vaccine may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss your medical history with your healthcare professional, especially if you have a current fever or illness, immune system disorders, or certain heart problems. If you are pregnant or breastfeeding, consult with your healthcare professional before receiving the vaccine. It's important to be aware that Moderna COVID 2023-24, 6mo-11yr, PF, 25 mcg/0.25 ml in suspension, EUA, COVID-19, SARS-CoV-2 vaccines may interact with other medications, which could affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your healthcare professional. It's essential to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This helps ensure your safety and the effectiveness of your treatment. The Moderna COVID 2023-24, 6mo-11yr, PF, 25 mcg/0.25 ml in suspension, EUA, COVID-19, SARS-CoV-2 vaccine is authorized for emergency use in children between the ages of 6 months and 11 years. This vaccine is given as a 0.25 milliliters dose administered into the muscle. It is designed to provide protection against the COVID-19 virus. The recommended dosage and timing for this vaccine should be discussed with your healthcare provider. It's important to keep up with your regular medical appointments and follow up with the healthcare professional who administered the vaccine. They may provide you with a COVID-19 vaccination card, which you should keep and be prepared to share when necessary for public health purposes. Make sure to receive each vaccination at the scheduled time. If you're unsure when to get each dose, ask your healthcare provider and mark it on your calendar. If you happen to miss a dose, be sure to consult your healthcare professional immediately to determine a new dosing schedule. This vaccine is administered in a medical facility and should not be kept at home. It is important to follow the guidance of healthcare professionals for the administration of this vaccine. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.